Hey, welcome to the Right Physical Therapy Show. Kate, I'm really proud of you in your brackets.
Hey, thank you.
You're doing really good.
Thank you very much.
You see that I bumped up to 116? I'm really moving up in the world.
It's funny, you beat me to it. I was going to say I'm very proud of you to move it up from 123 to 116.
123 to 116. Watch out. Here I come. Top of the leaderboard. Hope you've been jumping in with us on the bracketology, and it's a fun little game. Winner gets a $100 gift card to a restaurant here locally. We like to support the local restaurants, so it's a fun little game. But Kate Anderson's always like top 10.
Yeah, I don't know what it is. Yeah. I live in a fantasy world.
Yeah, you do, man.
I
do
do
really well. Hopefully you're having a great day today. Today is April Fool's Day.
It is April Fool's Day.
Right,
yeah,
Kate?
It sure is. It was April Fool's Day.
Yeah, we did some April Fools here at work, but we won't tell you what it was. But it was fun.
Some of us might start crying.
Some of us had fun, some did not.
It's true.
I got pranked today as well.
Yeah.
But hey, April Fool's Day. Happy birthday to my son, Crew. It's his birthday
Oh,
today.
nice.
So,
Happy birthday, Crew.
Big number 6. He was literally this morning as we're eating breakfast, like just strewing up things like, oh, I'm going to do this today and this today. I'm like, you're a 6-year-old. You should be thinking that way. So watch out for Crew Billings today.
He's coming.
He's on a tear. Well, today, let's just jump in. I'm Tyler Billings, Doctor of Physical Therapy. This is Dr. Cade Anderson, Doctor of Physical Therapy as well. And so we're gonna address the question that we received, which is Estim and Iastm.
Yes.
And what is this, and how does this benefit me?
It sounds like it's pretty much the same thing. I get this question a lot, like, oh, what's the difference? But they're quite different.
So you'll probably see on Facebook, we have a promotion going right now, a really good deal of 4 electrical stimulations, that's Estim, and Iastim sessions. So you get Estim and Iastim in a session for $90, so 4 sessions of that, and it ends this Monday. So act quickly so you can take advantage of that deal. It's really good stuff. So Estim, that's electrical stimulation. Just to frame the conversation here as we introduce it. This is electrical stimulation. Here, if you've had this before, you're loving life, right? So here's the pads. You would put this around the shoulder, right? You could do multiple things. You could do 2 pads. You could do 4 pads. So that's Estim. Basically, it's called a modality, right? So when it's a modality, this is used to negate pain. So when you hear the word modality, that just means we're reducing pain without the use of medication. That's a modality.
Yeah.
Decreasing pain without the use of a painkiller. And then Iastim. This fancy little tool, probably heard of this. It's Graston, Hot Grips, Gosha.
A lot of people call it just the scraper.
The scraper.
There's more to it than that.
There's a lot more to it than that. So this is Iastim. If you know what that stands for and you get the correct answer, I will personally buy you a candy bar, but you got 1 minute to put it on Facebook Live. So I'm just not going to say what that stands for here. As we get talking.
I'll let them know a little bit.
Yeah. So Kate will tell you what Iastim means. I-A-S-T-M. So hopefully they can type fast. You got now about 30 seconds left. So let's talk about some common injuries that that this would be for, the Estim or the Iastim. What injuries would you see this on?
Really bad anywhere, honestly, man. Like, some ones that really stand out to me would be like lateral elbow pain, like tennis elbow.
Yes.
That's one that we commonly use it in. Achilles tendinopathies, I would say we use it a lot in.
And you're talking an Iastim tool.
Iastim tool.
So we're talking this tool that deals with a common word we use, a tendinosis.
Yes.
So when you see this tool, you're thinking tendinosis.
Yep.
When you see this modality, hey, it's helping with pain, right?
Exactly.
This does as well, but in a different way. So tell me, what's a tendinosis? Okay, let's talk about that.
Yeah, tendinosis is basically a chronic tendinitis. We've all heard of tendinitis before, which is inflammation of the tendon. Tendons, a lot of weight bearing, or a lot of load comes onto them. That's where the muscle attaches to bone. So there's a lot of load as we do movement.
So muscle attaching to bone is a tendon.
Exactly, and tendons are great. They take a lot of load. They have the potential to be overworked because of that, though. And they also get a poor blood supply compared to a lot of other tissues in the body. And so it has the potential to become a chronic issue where it's just like you have it for months, years, for a long time, and you can't get rid of it because there's damage to that tendon that isn't healing the way it needs to. And so what we would use this for would be to help with the repair and remodel and get the healing process going, which we can dive into.
So let's talk about some of those tendon issues then.
Yeah.
Where are some common tendon injuries that you would need to use an Iastm tool? Your timer's up. What's the name of this?
Stands for Instrument Assisted Soft Tissue Mobilization. I'm looking to see if anybody got it.
Anyone get it? Brian, don't be brighty on there.
Yeah, so
I should have thought of that.
Instrument Assisted Soft Tissue Mobilization. So essentially soft tissue mobilization with the assistance of the instrument, right?
Yes.
Very easy when you think about it. But yeah, some common ones would be, again, the tendon from the forearm extensors that attaches into the lateral elbow, or what's commonly known as tennis elbow, right? Golfer's elbow on the other side is another common thing we use it on. We use it a lot on like patellar tendonitis or tendinosis that occurs, Achilles tendinosis. Really, honestly, anywhere. Another thing that we use it for, it's not all tendons. It actually works really well with trigger points as well. So a lot of people have had knots or trigger points in their musculature. I've used it quite a bit to the upper trap, which is a common area that we get it. The levator scapula, which happens from poor posture a lot of times. There's a lot of things you can use it for, and so that gives you an idea of some of the common things.
Awesome. So that's super helpful. That kind of frames the conversation for us. So let's jump into Estim. Let's start there. So this is also known as TENS. A lot of people call it TENS stimulation, electrical stimulation. There's different currents that you can use, and trust me, I'm not going to get into the physics of that because that'll make your head spin like it does mine. But basically what you need to understand is there are different waveforms that these Estim devices are using. So TENS, that's transcutaneous electrical neural stimulation is the breakdown of that word. That stays superficial. It doesn't go very deep, right? It's very tickly. It just stays on top of the skin. It doesn't get into the derma down below where you need it to at times. So TENS, it's a good device to use. Those are usually bought over the counter. You can buy them from most places now, right?
Yeah, on Amazon.
Fairly cost effective.
Yeah.
Then you have interferential. So interferential, it's we call it IFC, uses 4 pads. So it's required to use 4 pads, and I have to surround the joint, and I have the red lead and the black lead coming into the shoulder, and the machine is going to it's going to mix the current and cross it like this and make it more comfortable. So it's a stronger current, but the machine breaks it down into a waveform that's very comfortable, but it penetrates deep. So we use this a lot in physical therapy. People were laughing. I had a couple of people grab me, like when I was saying rehabs. When someone says we're doing rehabs, you should turn and run. This is what I mean. A lot of people think rehab is just this. Like, oh, I did rehab on my shoulder and I placed it on there. The correct thing to say would be, I'm doing pain. I'm getting my pain in my shoulder with a modality, right? I'm using a modality. Once again, remember, modality means the use of a use of a device to minimize pain without pain medication, right? So that's what that is. So IFC comes in here, a wavelength that we use a lot to decrease pain. So let's talk about how does it decrease pain, and then the next thing will be why it's important to use that, right? And maybe I'll jump into that first. Like, why is it important? Is, we've talked about this several times, the opioid epidemic that we've seen, right? That the painkiller, a specific type of painkiller that can become addictive and abusive in nature, that is being overutilized in the United States. And this is a great means to say, hey, we're fighting that epidemic of opioid use and saying, hey, how can we decrease pain without using something that can definitely become harmful? And I'm not saying that all opioids are bad and the use of them are bad, but the overutilization of them can really turn into something dangerous for people. So this is why we use a modality like this, so someone can have decreased pain and increased function, right? There's a cycle, right? It's pain, right? You have the pain, and then I go to do something, it causes more pain. We gotta break the cycle, because the pain's stopping you from exercising, stopping you from doing your job, whatever it is. There's a lot of things that can get in the way of. So we're gonna break the cycle of pain, where it's like, well, I feel the pain, I go to do something, I feel more pain, so I'm just going to pull away from it, and then pulling away from it causes more pain, right, because I'm not as active. So we got to come in and cut this cycle, and that is why this is important, right? It can increase function, it can increase motion, it can decrease pain, and it's a really effective tool.
Yeah, the way I always look at this is, Eastim, in and of itself, the research doesn't show that Eastim is that effective in fixing a condition, a musculoskeletal condition, right? Like,
great call.
In and of itself, it's not going to get to the root and fix anything. I like to use it for this. Exactly what he said. If you can break the pain cycle and allow somebody to move more because they're out of pain, you're good. That's a great thing to do. So one thing I always make sure to educate my patients on is that motion is lotion. Right? I love that phrase, right? When you have a joint issue, there's actually, a capsule around each joint that has synovial fluid on the inside. Synovial fluid, it's full of proteoglycans. It actually gives the nutrition to your joint, right? To the cartilage and to the actual bone layers, or the most superficial bone layers of the joint. It's important. And when it doesn't move, it actually doesn't have the same effect. Yeah. It has the effect when it's moving around in the joint through motion, and so they say motion is lotion, right? Yeah. I always look at it this way. It's almost like as if you had food where the nutrition behind it isn't really activated until you put it in the blender, right? Like it has to be able to move. That's when it activates the nutritional value to the joint. So you have to move. The problem is that when we're in so much pain that we don't move, then we don't. Then that kind of function isn't happening, right? And so you have to be able to move, and this is what Iastm is great for. It allows you to be able to move because it breaks the pain cycle. It's going to come right back, but hopefully it gives you the opportunity to make some ground and some progress in the meantime.
Wow, write that down. Motion is lotion.
That's right.
You really made my brain think of the research that's out there, Kate. I love what you taught there. Like, I hope you heard that. Like, moving your joint is what's going to heal your joint, not just, oh, I got more motion now. Like, it's actually going to heal your joint. And I think of the shoulder article. We hear this a lot, especially with the shoulder. Like, ooh, had rotator cuff surgery. I'm stuck here. My doctor says I can't move my shoulder for 6 weeks. No motion at all. Not even passive motion, meaning I'm grabbing his shoulder and I'm moving it. Like, that motion, in the research, without question, will heal that shoulder or heal that back, that subtle motion, because you're activating the healing process inside the actual joint, the science of it. So that's powerful.
Yep.
Wow, thank you, man. And so the theory, let's talk about this. So how does this work in decreasing pain? The best way I can think of, and I hope, and I'm going to quiz Rebecca if she gets this. I got to make sure this makes sense, because I love it. It makes sense to me. So pretend you're walking through the living room and you hit your knee on that darn coffee table. We've all, you're just like right on the corner, boom. What's the first thing that you do, Rebecca, if you hit your knee on the coffee table?
Usually cover my mouth.
Yeah. What's the second thing you do? She said she covers her mouth. What's the second thing you do?
Grab that area in pain. Usually.
So she grabs it and rubs that area in pain. So if you hit it, I'll just pretend I'm like, ooh, and I rub it like this. Does that make it feel better?
It does.
It does. It makes it feel better. If I do that long enough, okay, it's going to just keep feeling better. So that's actually a wise thing to do, get the pain down. That's what this is doing. It's basically sending a vibration, electrical vibration, into the skin. It's super comfortable. And what it does is there's several types of pain fibers. So you have C fibers. C fibers are your smaller fibers. They have no myelination. This is perfect.
That is perfect. Look at that.
So here is some bubble wrap. Okay, hold out your arm.
Okay.
So this is a C fiber with no myelination. Myelination is the sheath that covers around it like this, insulates it, and then there's little gaps in it, and it just keeps going. So your C fiber has nothing. Then your A and B fibers, right? So your alpha, beta fibers. These are the ones that you rub your knee with. So you're like, ow, that really hurts. So I'm rubbing my knee right here, and I have these fibers. It's going to skip, and it's called the nodes of Ranvier.
Yes,
I love that name.
Yeah.
So
speeds up the electrical impulse.
It speeds it up, so it goes boom, 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 and it goes to the spinal cord, and then your brain senses the pain. It's a crazy mechanism of how we sense pain. So you have the C fiber coming, let's go here. C fibers coming slower, and then the myelinated one with the bubble wrap is like boom, boom. I'm going to beat you to the race here, and then the door closes. So once this B fiber gets through to the spinal cord, it goes boom. That's the gate theory, and this pain just keeps hitting this door because it senses the vibration coming from the electrical stimulation. So that's how pain will be decreased. It's the gate theory, and it actually will release endorphins. When that gate is shut, it releases endorphins. So if we can get it deeper into the skin in a pulsating fashion, in the research, the pulsating fashion will release endorphins, a hormone that will actually have a longer lasting pain relief. So there's your, does that make sense?
Wow.
Yes.
So there it is.
PT show's good today, man.
It is good,
That's
man.
really good.
We're getting deep.
I think it's so interesting. Let's just dive into science for a second. I think it's, our body is incredible.
It is.
So he described that pain, what am I trying to say? The stimulation going up to the spinal cord. What's really interesting is that if you step on a nail, for example, that comes up through the C fibers to your spinal cord. From there, it's supposed to go up to your brain, but it knows that it's in danger, so it does a little whoop reflex, right?
It
reflexes, it kicks it straight back to say, get away from the nail.
Yes.
It doesn't have to go to your brain. When you step on a nail, have you ever been like, oh, I stepped on a nail. Now I'm going to pull off. It's not a conscious thing. It just automatically happens, right? The body is so cool. It does that little reflex loop and says, pull away before you even know it happened, right? Which is cool. The body does protect it, and you can use something like Eastim to help protect it, right? Which is really cool. I think that was really cool to talk about.
So where can this be a dangerous thing? You know, you're thinking like, well, how can this be dangerous? It's like taking an opioid. It's like, hey, I got this on my shoulder all day long. I hear this a lot. Or Tens. I'm using Tens. I bought this thing on Amazon, and it's just buzzing on my shoulder, and it feels good. After a while, your shoulder will get used to that buzzing, right? Your body's smart, like he said, so the effects wear off. But where it becomes dangerous is where someone's like, hey, I have this on all day or in my low back, and I can't really even feel my back. It's similar to being on a painkiller. It's like, well, then you don't know what's causing the pain. You don't know if your knee is clocking into a coffee table, for instance. Like, you don't know, hey, I'm straining my back as I'm driving wherever to Sun Valley, and I'm just sitting in the car, and I'm like, it feels good. And you take the pads off, and you're like, oh boy, right? That's where it becomes dangerous. The overutilization of a modality, it's not getting to the root of the pain, it's just masking it, right? But when you include IFC with physical therapy in conjunction with Iastm tool, that's why we're combining the two of them, then you get true healing of the tissue.
Absolutely, and I love what you said. You said earlier that when you get the release, sorry, I was going to take that back for a minute. When you have the Estim on there, that you actually the brain will release endorphins, right? Well, the actual breakdown scientific term of endorphins is endogenous opioids, correct? So what that means is it's naturally made opioids that get released through glands, right, through the brain to your body to relieve pain. And so it's just like we said with opioids. Opioids aren't bad when used the way that they're supposed to be used, right? The same thing here. Natural opioids are a good thing. Unless you overuse it, right? So if you're using this TENS unit to just have this constant release of endogenous opioids, that can become a problem over time as well, right? To the point that it'll quit working because the body gets used to it, right? So there's just a lot of things, and then you need more and more of it. It just causes this cascade effect. So anything else with Eastim?
I was going to say, the take home for Eastim is it can't be just used by itself to heal tissue, to heal an injury. It can be utilized for pain, right? It can use to increase healing. We've seen that before when you use IFC. TENS won't do the healing touch of that. So hopefully that you understand the take-home message. IFC combined is
exactly.
really heal something.
I'll talk about Iastm for a minute.
Let's do it. Let's
I love this tool. You've probably seen this in a lot of different shapes and sizes, perhaps. There's different shapes and sizes for different parts of the body to get to the different angles that you need to get to. Essentially, this is what Iastm does. It's mobilizing the soft tissue. It can help break down scar tissue. It can increase blood flow into the area. One thing it can do, I think we've all felt trigger points before in the upper trap, wherever it may be. It actually does what's called neural inhibition of tone. So a trigger point is essentially an increased tone of the muscle. It's been overused. I always picture it like when you're stressed and having a panic attack, you go in the corner and you kind of ball up like you can't take anymore. That's essentially that's a simple way to say what the muscle's doing when it's in a knot, right? So that's one thing to do is you get this neural inhibition from the brain through a light stimulus, for example. In fact, let's talk about that for a second. Let's say that you have high tone because you've developed a tendinosis. The body's trying to protect it, it's getting tight, you're getting some knots in through this area. That's something that we commonly see. What you can do, now some people have probably seen where they get in there and they're just digging as hard as you can. You actually get what's called petechiae or bruising through that area. Research has shown that that can be effective with some things, but actually not most things. They actually show that it's better to do a really light touch. Now sometimes I do this to people and I think people are looking at me thinking, I don't get what this is doing, because I'm not going super hard, right? You have to go at a certain angle, you have to go in the direction of muscle fibers, and you have to go the same way over and over again, so I don't go back, forth. It's here, lift, here, lift, at this 35-degree angle to the muscle. And what happens is that that light stimulus will actually send a signal up to the brain of like, hey, something's touching this, it's fine, I guess I can relax. And it'll actually send this release, sort of a neuromuscular reset to the area to get it to release, for example. So that's one way that we could use it. You know, I use it a lot with, specifically with trigger points. One thing that I have found to be quite effective is what's called ischemic compression, coupled with Iastm. Ischemic compression, maybe you felt this before, sometimes you just want to put pressure on a trigger point. When you put pressure on a trigger point, you actually, you block blood flow into that trigger point. And what will happen is if you do that for a while, the muscle, because it needs blood flow to function, right? It needs blood flow. That's what brings oxygen into it. It's not healthy, and it's going to be just like us without oxygen. It's going to start to panic. A lot of times it'll start to pulse, and when you let go, blood flow comes rushing in, and then that actually causes a reset to that area because it's trying to replenish itself with oxygen. When you follow that up with Iastm, that light touch, you can really get things to relax really well. So that gives you an example of some things that you can do with this, things that really help quite a bit. So, you know, the science behind this, you know, when you do this, we actually had an experience of this where we did our own little mini experiment here at Right PT. Anybody that's had a tendon issue, if you go to a sports medicine doctor, you know, Dr. Chad Johnson does this here in Twin Falls. There's others throughout all the other locations that we serve where they can actually do ultrasound, an ultrasound image on the tendon. And what they find is that when you have damage to a tendon, it almost looks like this hollowed out tube a little bit. Like when they go look at it, it's actually supposed to be white and shiny, and that's what a healthy tendon looks like, but it's got a lot of black in it. It looks like somebody went aerated through there and like overdid it, honestly, is what it always reminds me of. Just a lot of damage to the tendon. You know, we did a little experiment where we took somebody, they got an image on their calf that they had a slight tear in that developed into a tendinosis. We did Iastm for a while, and what that does is a couple things. It promotes phagocytosis, which is phagocytes. It's a cell that comes in and cleans things up. And so if there's all sorts of just like, I always call it, I don't know if this is even a word, but I use the word gunky.
I like
gunky. It's like gunky material in there it's like dead, right? It's damaged, it's dead. It goes in and actually eats that, it cleans it up. And then after that, what happens is fibroblasts come in. Fibroblasts are kind of like the construction workers. They bring in, they stimulate collagen synthesis, and they come in and they actually remodel things. And so we did that for about a 2-week period with this person, sent them back in for imaging, and all that black stuff had actually filled in, right?
You can you can see where it was being scraped. Like you can see the actual zone.
Yeah, so it repaired and remodeled and actually grew in that tissue again. So this always blew my mind before I went to PT school. Like, how could somebody have like a rotator cuff tear, for example, and just not have to get surgery? I'm like, it's torn. Doesn't it have to be like sewed together? No, the body will do it, and we can help stimulate that through the use of something like Iastm.
The appropriate growth of collagen, right? And we talked a lot about collagen. Like, if we do nothing on that calf, it's going to just fill up with scar tissue. Scar tissue is similar to collagen, but scar tissue just comes in and just says, look, I'm just going to lay down all weird, right? And be all haphazard. That's a great word.
Yes.
Weird. It's going to lay down all weird. Gunky and weird. But it's going to lay down all haphazardly, but when you come in with a tool, it's going to churn the type 3 collagen into type 1, right? Exactly. So type 3 is the initial collagen that gets laid down. It's weaker. It doesn't support it. That's where you're like, dude, my Achilles feels good. I'm going to go play basketball.
For sure.
Hope you're watching this, Brian. But hey, my Achilles feels good. I got type 3 collagen filling in the gaps. It's starting to feel good. And then I go play and pop, there it goes again. Issue is not laying down the way it needs to. So you need to get it aligned where it needs to align, and it's a stronger type collagen, type 1. That's where the tool will come in.
Yep, absolutely. So, I think some main takeaways from this: Iastim and Estim, completely different things.
Yep.
They're both meant to be, they're both meant to help with the healing, but not do the actual healing, right?
Yes.
Like there's more that's needed to it. They are somewhat effective on their own, but it would never get to the root of the problem and completely fix something. And so when you combine these with formal physical therapy after a true assessment that's been done to get to the root of the pain, it helps things be highly, highly effective.
Yeah, great. I have nothing to add to that. Check out the offer on Facebook, four sessions for $90 where you can get Estim. Here it is, it fell through down. Estim and Iastim for $90. The sale ends by Monday, right? Monday.
Yeah.
So hopefully we see you. If you have any questions regarding this, look us up at rightpt.com, and I hope this was informal. Any questions? Anything that we have?
No questions.
All right, we get off scot-free.
Can you do me a favor?
Yeah.
If I win the bracket challenge, which I'm in line to possibly do,
Yeah.
next week we'll be back. Can you give me something, just like a crown, like a championship belt?
Yeah, I will.
Something?
Yeah,
Even
something.
a paper that just says, I am the
No,
champion.
we're not doing
period.
just paper. There's got to be something better.
Yeah,
We can
that's
do
all I
something.
ask. Like, I just want people to make a big deal out of it.
Yeah, Miss Bracketology or something.
Miss Bracketology. Yeah,
Okay,
sure.
thanks guys. Peace.
Yeah, thank you.